Hello friends, I am Dr. Surekha Pradeep Matkar, Ghatkopar, Amrut Nursing Home. I am practicing here for last 30 years, which includes OBS, Gynac and IVF infertility cases. Today I am going to tell you about embryo transfer in previously failed IVF cases. Mother Nature, by its motherly nature, nurtures the embryo very well. But the intricacies are so much, but human beings really can't reach that. But let us try our level best. Embryo transfer is a very important step in the process of assisted reproduction. Rather, it is the final but the most important step. Though looks very simple, according to me, it is the most difficult step. We deposit the embryos into the uterine cavity at proper time. Where do the things go wrong? To make things successful, let us find out where we have to be more and more particular. The embryo culture on day 2 to day 4, which is cleavage stage, they can be inserted, or blastocyst stage, that is day 5 or day 6. Prior to that, we prime the endometrium. Uterine internal lining is monitored by ultrasonography. Endometrium, we give estrogen for 14 days. We measure the endometrium, triple lining, its vascularity is monitored. At proper timing, progesterone is added, and many times we add many other factors which add to the better vascularity of endometrium. After that, when the embryo is transferred, it can be single or double embryo transfer is done. Earlier, we used to do multiple embryos, but that used to lead to twins. But now either single or double embryos are transferred. To have better and better quality of embryos, we have to start by better stimulation. Procedure of embryo transfer, we take proper precaution at the cervical level, clear the mucus, flush the cervix with media. Soft catheter is introduced, external catheter under sonography guidance, very gently, just going beyond the internal os, and then your embryologist comes with loaded embryos and he will insert the inner catheter, and we deposit the embryos just 1.5 centimeter below the fundus in the uterine cavity. You wait for some time to avoid negative pressure sucking the embryos back. Rotate 30 seconds and both the catheters are gradually withdrawn. Embryologist will check whether there are any retained embryos. That completes the procedure. And patient is advised estrogen, progesterone, in required cases low molecular weight heparin, progesterone injections when required, or vaginal progesterone. After this is the time you keep on waiting for 14 days till for beta HCG report. To have better and better results, what are the places where we can change? In the efforts to succeed in failed cases, we have found sticking to some of the factors which I am going to mention has been helping a lot in giving good results. Selection of good embryos, ERA test to get the exact endometrial lining and proper timing. Some of the cases with natural cycle transfer is giving very good results. Ultrasound guided embryo transfer, which we all do. All these factors help the patient in getting better success. Serum progesterone level is another very important factor to be monitored. Some adjuvant procedures came up to allow sticking embryo glue, that is hyaluronic acid, which was introduced for so that the embryo sticks inside the uterine cavity. Some people have been using GCSF, granulocyte colony stimulating factor. This factor is present in early pregnancy and also at when embryo implantation occurs. So, introduction of this factor is helping in better results. Some have been using PRP, that is autologous platelet rich plasma, which is inserted in the uterine cavity, which we are getting very good results. Now, for failed cases, let us think right from one end to the other. Which are the places where we can alter, which we can do better for result. Most of the patients are in higher age group. So first, the embryo itself can be a problem. Most of the times, patient with the age of below 35, the implantation rate is 50%, and whereas it is 41 to 42 years of age, the implantation rate is 12%. Here makes the difference because of chromosomal abnormalities. So here we can either see by PGD, pre-implantation diagnosis, diagnose on day 2 and day 3, and if it is a good embryo, there is no chromosomal abnormality, you transfer on as a blastocyst. Another option is they should go for egg donor, young donor's egg, which can always give good results. Besides this, recombinant injections, FSH, and better stimulating medicines are also improving egg quality, leading to embryo quality. Also, sperm quality should be checked. Fragmentation has to be checked. After embryo, you go to endometrium. Uterus by its position, by its cavity, anatomically, cavity shape, its autoimmune reactions, other factors like hormonal balance, thyroid, all these factors come into the picture when embryo implantation is responsible. When you find a patient who has failed earlier, for uterine receptivity, new concept has come that is called as ERA test, endometrium receptivity array or analysis. Here we take endometrial biopsy and it is analyzed, almost 236 genes expression is analyzed, and then you get the result as receptive or non-receptive. Of course, the timing required to get the result is 3 weeks. So, you have to do this test in the prior cycle, and since it is repetitive, meaning the endometrium behaves in similar manner in the next time also. So, embryo is inserted into the next cycle. This is found to be very, very useful because there is a concept called as implantation window. From 19th till 23rd day of menstrual cycle is the implantation window. 84% of the females, they are receptive during this window, but 16% have deviation either earlier or later. So these are the 16% of the cases who may require this ERA test, and it has been really working very well in failed cases. Many times I have found patients with COX, especially in India, we get failures whether you can't explain any other reason. To succeed indeed, we require God's blessings. Only He can make impossible things possible. Hope you have understood the efforts at different levels being taken by ART specialists to succeed in this difficult task. If you have any problems or any difficulties, you can always contact me on library.com. Thank you.